Good evening. Thanks for joining us for this COVID-19 vaccine virtual town hall. My name is Tammy Sander, and I've been doing communications with the Hamilton County Health Department since the pandemic began back in March. I'll be joined tonight by a panel of health experts from the Hamilton County Health Department. We'll start the night by explaining the latest statistics in Hamilton County and how we stack up statewide. We'll spend a little time discussing the State Department of Health's color-coded metric system, how that's calculated and what it means for us here in Hamilton County directly. We'll take a closer look at what exactly an mRNA vaccine is, how it's created, how it's different than the vaccines you've received in the past, and why this science is key to getting more people vaccinated even faster. After that, we'll discuss vaccine eligibility and explain how that is determined. And we'll offer some tips for getting that ever elusive appointment. Believe it or not, there are actually some hacks that are out there to help you get on the calendar. And of course, we'll talk about what it'll take for us to get to herd immunity. We'll also be taking your questions after we get through our presentation. So just look for the Q&A box on the right-hand side of your screen. Feel free to send us some questions and we'll try to get to as many of them as we can tonight. But let me start by introducing tonight's panel. Jason Leemaster has worked in the field of public health for 27 years, the last 24 years with the Hamilton County Health Department. He is our Director of Environmental Health and oversees restaurant inspections and water quality. He tests public swimming pools and private wells. In addition to that, he oversees on-site sewage disposal and mosquito control. He is currently serving as the Health Department's interim administrator after the untimely passing of Barry McNulty last month. Christian Walker is the Health Department's emergency preparedness coordinator. His job is to be prepared for public health crises like the one that we're currently in. He spends his days coordinating with local, state, and federal agencies in responding to the pandemic. Chris is the lead planner and advisor for our local testing sites and vaccine clinics. He works tirelessly behind the scenes to ensure the needs of residents of Hamilton County are met and in many cases exceeded. And finally, Jim Ginder has been a health education specialist with the Hamilton County Health Department for 24 years. Jim has logged thousands of hours teaching health courses to everyone from preschoolers to senior citizens. Jim is a national registered emergency medical technician, an EMT instructor, and EMS educator. He has been the lead point person for Hamilton County schools throughout the pandemic. I'll turn it over now to Chris Walker to provide us with the latest COVID-19 numbers, as well as an explanation of our color-coded county system. Chris?
Hey, good evening, everyone. Currently, we have over 29,000 cases, or have had 29,000 positive cases in Hamilton County, along with 320 deaths. That puts us fourth highest in cases behind Marion, Lake, and Allen counties, and sixth highest in deaths behind Marion, Lake, Allen, St. Joe, and Elkhart counties. Statewide, you can see that we've had 167,000 total cases and nearly 10,000 deaths statewide as well. Today, we dropped down to the orange advisory level, or I'm sorry, we remained at the orange advisory level. Our positivity rate has dropped significantly. I think we peaked at one point at nearly 17% for our all positive. So we're seeing a pretty big change in the infection rate here in the county, and it's going in the right direction. Our infection rate is going down considerably. So I think this slide and the next couple, we're going to discuss how we get these metrics. So as you can see on the right-hand side, these are the percentages or the metrics to get us in the red, orange, yellow, or blue categories. Our positivity rate rates us as an orange. That would score us 2 points. Our cases per 100,000 puts us in the red category, so that gets we get scored a 3 points on that. So you take your 3 points for the cases per 100,000 plus your 2 points for positivity rate to get 5, divided by 2, and that gives us a aggregate score of a 2.5, which is in the orange. The great news is that as of today, we have moved to the orange advisory level, which allows us to open up our public gatherings to 50 people. Our K through 12 sporting events go up to 25% capacity, and it increases private events as well, and business gatherings as well. We'll start talking about some numbers of the vaccine at this point. Currently, we have administered in the county 58,000 doses. That is the second highest in the state, behind Marion County. We've done approximately, or we account for approximately 6.4% of the total vaccines administered within the county, or within the state, I'm sorry. And our total population is 5.8% of the state's population. So we're a little above where you would kind of think we would shake out. So we're humming along here, and we're doing good things with our vaccination.
Good evening. As Tammy said, my name is Jim Ginder, and I'm the health education specialist with the health department. So I'm going to spend a little bit of time tonight talking about the different types of vaccines we have out there. So currently, the only two vaccines that have emergency authorization from the FDA and the CDC are the Pfizer and the Moderna. And a lot of people have lots of questions about these two different vaccines. Both of the vaccines are mRNA vaccines, which is awesome. So they're basically made of the same thing. So they're made of the mRNA, and basically that mRNA is encapsulated with fat. And when you look at it, the two big differences is Pfizer is usually you'll get a Pfizer vaccine from a hospital just because that Pfizer vaccine has to be kept ultra cold. And at health departments or other clinics, you'll probably get the Moderna because that is actually that vaccine is easier to manage and doesn't have to have that ultra cold temperatures. You'll see Pfizer, that's 21 days between the vaccines, and Moderna is actually 28 days as well too. Also with Pfizer, with their clinical trials, they use 16-year-olds and older. So if we have a 16-year-old, they can actually get Pfizer. And Moderna, when they did their clinical trials where they used 18 years and older. So those are some of the big differences when we talk about the two different types of vaccines that are out there. So you can also see there's some other vaccines in the works. You can see the AstraZeneca and then Johnson & Johnson. Those are probably going to be the next two that are going to be approved by the FDA and the CDC. They're actually in their third stage of clinical trials right now. So once that happens is then they submit all their data to the CDC and also to the FDA for the emergency authorization approval. The other two are kind of way down in the pipeline for getting approved by the FDA and the CDC. And what's kind of interesting is when you look at all these are not mRNA vaccines. These are totally different vaccines. So again, once they finish their clinical trials, they will actually send their data to the FDA and the CDC. Then they will go ahead, and if they have done everything they needed to do, the CDC and the FDA will actually do an emergency authorization on the AstraZeneca and the Johnson & Johnson one as well. So we're hoping probably by February or mid-March, we'll have the AstraZeneca and the Johnson & Johnson one approved to use as well too. So one of the questions that we have out here is, can I choose which vaccine I would like to have? Well, that's going to depend on what location that you schedule your vaccine for. Like a great example, a lot of the hospitals will, like Riverview or IU North or St. Vincent's, has the ability to have the Pfizer vaccine available. But if you choose things like the health department or another type of clinic, we may only be able to have the Moderna available just because of the temperatures that we're able to maintain with that as well too. Another question is, will these vaccines work on the different strains of the new COVID virus that we're seeing from Africa and from the UK and from some other places? Well, currently right now, there are some good research studies out there that says Pfizer and Moderna will actually work against these new strains or the variant strains of COVID-19. So we're just waiting for more clinical data to come out to say, yes, it's 100% effective. But right now, the researchers are saying we think it's going to work on these variant strains of the virus as well too. The next question is, how long will the vaccine protect me? And that's a great question. We just don't know. We know that once you get your first vaccine, within 14 days, you're about 50% protected. But when you receive your second one, which is going to be in 28 days, we know that, especially for the Moderna, you're about 94% protected. But if you have the ability to get the Pfizer, you're actually 95% protected. And again, these new vaccines are mRNA vaccines, and that type of technology has been out forever and ever and ever, but we just don't see it a lot. So that's the reason why that we need to do some more clinical trials to see how long immunity really is as well too. And how do we know that the vaccine is safe? And that's a great question as well too. And then when we talk about any new vaccine that comes out, we do those clinical trials, and there's different stages of clinical trials. And once that they've collected that data, it's actually sent to the Centers for Disease Control in the FDA. And once they approve it, that data is also sent to the state health departments as well too. And Dr. Weaver, who is our Chief Medical Officer here at the Indiana Department of Health, actually has an advisory team as well too that looks over that data as well too. And if they have any questions or concerns, they can throw those questions or concerns back to the CDC or the FDA as well too. And the next question is, what are my chances of having an allergic reaction? And we're going to talk a little bit about that in just a second. I can tell you, I'm also one of the vaccinators at our clinic, and knock on wood, we have not had any individuals that have had any issues with the vaccine. And we're going to talk about that in just a second with our next slide as well too. Looks like we're having some technical difficulties here. So when we talk, and as we there we go. So here's some common side effects of the vaccine that we see. So one of the things I tell individuals before we give them the vaccine, that you could have some of these side effects of the vaccine. And I always tell the individuals that I give the vaccine for, or to I should say, is that usually the second day you could have some arm pain, you could have a low-grade fever as well too. And I usually tell them that if they have those signs and symptoms, to take whatever their physician or healthcare provider usually tells them to take if they have a low-grade fever, or if they're not feeling it as well too. One of the things about the allergic reactions that we'll talk a little bit about here in just a second is before we give the vaccine, when the person actually enters the immunization clinic, we ask questions. Then before they get the vaccine as well too, we ask specific questions as well too.
Well, this actually in vaccine eligibility certainly seems to be one of the big issues and new issues as we move through this distribution plan that we're actually following from the State Department of Health. And certainly one of the things about eligibility comes from the issues of who's most vulnerable. And certainly it's looking at healthcare professionals, frontline workers, those that are going to be exposed in direct contact with the virus. So eligibility so far in the phase 1A and starting into the 1B groups has started with our healthcare professionals, first responders, law enforcement, fire, EMS, especially. And then as we have started to move somewhat into kind of like that public distribution side of it, we're coming down through age groups and age-based vulnerable populations. We started out quickly with 80-year-olds, then moved into the 70-year-old class, and of course everybody is waiting for us to see the state move into the 60 or 65 plus. I do know that as we move into the 65 plus, that's going to open it up across the state to about 350,000 more eligible people. So large classes in these vulnerable populations, and that's kind of how we're working through this with the state plans. Of course, with that certainly is certainly the demand is out there. So demand is very high. It brings us in. We've seen a lot with questions like, what about teachers? When are teachers going to be next? Right now, we as well are following along the distribution plans that have been set forth by the State Department of Health. And with the demand in our population in our county, we have a lot of that vulnerable population in those age groups. So it's going to take a little while. People need to be patient, and we're working into those other groups. And as those are added on to the plans, then they'll be taken care of. Certainly things like that, the underlying health conditions that are out there, we're going to start seeing more of that as we expand out into the lower age classes and things. And then certainly I just kind of mentioned a couple of times, we're going to talk a little bit more about that, how that breakdown is who's determining that. And currently that's determined by the plan that's set forth by the State Department of Health. The State Department of Health has done a great job in trying to break out Indiana's plan for distribution of what might be considered or said to be limited supply because we have such a demand. And they established advisory groups, multiple advisory groups. I believe it was close to 60 to 70 individuals were brought together and put into some different development advisory groups to basically try to help us determine what the best ethical and equitable means of distributing this vaccine to disabled population, minority populations, and then of course looking at those vulnerable populations. So they've done a really great job at trying to do the best we can do with the amount of vaccine that we have here in the state of Indiana. And then certainly it kind of brings us to that kind of who should maybe be thinking about vaccines, talking with their physicians and those kinds of things, checking with their healthcare provider, pregnant and nursing women, immunosuppressed medication individuals. And of course, right now, the current vaccines that are available to us, Pfizer or Moderna, which we happen to be delivering at the health department, right now, those aren't available to the younger populations below 18. And then as well as recovering from COVID-19. I think one thing to mention about that, it's still being recommended that individuals that have been positive for COVID should also get vaccinated. But with that, the studies and determinations is there's about 90 days of immunity kind of documented with that. So you can wait a little time period before getting vaccinated, and that will also help us distribute vaccines a little bit better out there. So the next thing is how do we make an appointment? And there's some great outlets, and this may have been what Tammy kind of said, hacks that are out there. And the first and foremost is the rshot.in.gov website. That's where you can create appointments and look for appointment times and locations. If you need assistance, there's available assistance out there by calling 211. You can also contact the Area Agency for Aging. The AARP has available assistance, and one of the newest, and I think probably one of the other greatest opportunities out there is becoming using our librarians and local libraries. The FSSA at the state has worked to help train up librarians and get that going in our local libraries. So if you're looking for an outlet or a location because you need access to a computer, you can go to your local library and get an appointment made.
So one thing that people need to understand that when it comes time to make an appointment, we have to be patient about this. Dr. Weaver, as I've mentioned her before, she is our medical advisor for the Indiana Department of Health. She recommends, if you can, doing it at night and early mornings and weekends. Usually at night, they put more staff members on to be able to help the individuals as well too. Something to also please understand, once you get in the waiting room, don't hang up. Or once you get in, if you're doing it online, once you get into the holding room, don't log out. Because if you hang up or you log out, then you have to start the process all over again. And also it's really important that, and we're going to talk about this in just a second as well, please do not make multiple appointments, because if you would make a multiple appointment, then that takes an appointment off for somebody else as well too. And we're seeing that happen a lot, where an individual has 5 or 6 appointments because they were shopping for the best vaccine for them. So please stick to one appointment as well too, and just hang on. You'll get in. It may take a while, but don't hang up. Stay on the line as well too, or in that holding room as well.
All right, I'm going to talk a little bit about our vaccine operations that we're currently undergoing here in Hamilton County. Our location is located at the Annex Building at the 4-H Fairgrounds. That's 2003 Pleasant Street, Noblesville. We'll be operating out of there through Friday. Our hours of operation are 9 a.m. to 4 p.m. And then effective Monday, February 1st, we will be moving into the Exhibition Center. Same address, 2003 Pleasant Street, much larger facility, allows us to grow as more vaccine becomes available, and provides more opportunity for folks to get in and get vaccinated sooner. So, and this is such a fast evolving situation. This slide that was created less than an hour ago is already out of date. We currently have 2 Meyer locations in our county, which are open and providing vaccinations. One is the West Carmel Drive Meyer in
We lost Chris.
I can jump in there real quick if I think we may have lost Chris's microphone. I'm not sure.
I think I might be back. So.
Okay.
Did you hear me talk about Walmart?
No.
Okay, so the Walmart in Noblesville is also providing vaccine as well. And you can register at Walmart or for the Walmart site through the ourshot.in.gov. The Meyer locations are providing their own registration system. I think we've tried to express this throughout this entire process. This whole thing from day one has been a community-wide effort. You see some of the folks that we work with there with the fire departments, the sheriff's department, emergency management have all stepped in to provide staffing to assist us with vaccination. Trinity Free Clinic's been a great partner with testing as well as coming in and help getting us up off the ground with vaccination. The CERT team has been great, providing volunteers to help manage traffic control. Our information services has been fantastic, helping us get ready to move into the new location, running thousands and thousands of feet of cabling and wiring to ensure that we have connectivity to help service the community. Our buildings and grounds folks have been tirelessly working to make sure our facilities are clean, sanitized, ready to go every day for us. And of course, none of this would happen without the support of our elected officials at the county or at the city levels as well. They've all been putting their every effort they can in to help support us and help make the county successful in this effort.
So as a vaccinator, let me explain to you what the process is going to be if you decide to come to our facility at the 4-H grounds, as Chris was talking about. What's going to happen is you're going to come in and you're going to register with one of our individuals at our table, and they're just going to ask you some quick information and verify that it's you. Then what happens is you'll actually move to one of the vaccination tables. Then who's ever vaccinating you will ask you some additional information as well too. You will receive this card that you see on your screen. This is from the Centers for Disease Control. You'll have your last name, first name, date of birth. There'll be a sticker on this card with the lot number, the Moderna if you come to our location, and if you receive the vaccine in the right or left deltoid as well too. It is so important that before people leave that they make sure that they schedule their second dose. So we can guarantee that if you get your first dose with us, we will have a second dose for you. So on the back of the card, there's a sheet where before somebody leaves that we can go ahead and schedule their second dose as well too. And it's so important that a person brings this card back with them for their second visit so we can put their second dose as well too. And you can keep this for your records to give to your healthcare provider as well too. Also, this data from our program that we're using from the State Department of Health is actually downloaded into the state immunization registry as well too. So if your healthcare provider has access to CHIRP, they're able to see that you've received your COVID vaccine. It was the Moderna. You received it from the Hamilton County Health Department and your right or left deltoid, the date, so they have that data as well too. Something that's really important to understand with the Moderna vaccine and the Pfizer vaccine is you need to make sure that you receive your second dose as well too. And in the Centers for Disease Control actually just came out on Monday saying that you have 42 days from your first vaccine to receive your second vaccine. What that means is we have individuals who get their first vaccine, then they say that they're going, let's say, to Florida, and they won't be back until May. Well, that's something we need to think about because you've got 42 days between your first one and your second one. That's the longest you can wait to receive that second vaccine. So we really like to get that second vaccine with Moderna in that person's arm within 28 days, but we can go up to 42. But if it's over 42, then the manufacturers of Moderna can't guarantee that that vaccine is gonna be effective or not. So another great program that the CDC has, and I actually have done this is called VSafe. And this is a great program. So when you come in to see us at the health department, at our vaccination sites, you'll be given some information about the Moderna, and you'll also be given a handout called VSafe. It's a pretty cool program. What you do is you can either scan the barcode on your phone, or there's a web address you can go in and you register with the Centers for Disease Control. And what they will do is with your initial vaccine, every 3 days, you'll actually receive an email with questions to say, hey, how you feeling? How you doing? Do you have any of these symptoms? Were you able to work? And if you hit any of the high risk questions, somebody from the CDC will automatically call you and say, hey, what's going on? Let us know what your side effects are. We need to know this. So this is an option that you'll be given when you come in to get your vaccine. I highly recommend it. I just finished up my second vaccine, and I'm still getting text messages for them asking me how I'm doing, which is awesome as well too. So one of the questions that we see is, will there be enough will there be enough vaccine for a second dose? And the answer is yes. So please remember that if you go to, let's say you come to our clinic at the 4-H grounds, you are guaranteed a second dose. But the issue is, if you, let's say you decide to go to Florida, they may not have that dose to give you. So it's really important this time of year, because we know a lot of people like to go to Florida where it's nice and warm, and I don't blame you. But you need to understand that if you get your first vaccine with us, Florida may not have enough for your second vaccine. We will guarantee that we have that second vaccine as well too. So that's something that you need to think about if you are going to Florida for the next few months since it's warm, that maybe if you can put that off until you get your second vaccine, because with us, you're guaranteed to get that second vaccine as well too. Another question we always get is there a standby list? And the answer is no. We do not have a standby list. And the reason why is because we have a great bunch of nurses who oversee our vaccine, who does an awesome job with that vaccine management. I can tell you that giving vaccines is we are to the dose. So we've had all these people schedule and show up, and we've not had any extra doses. So our staff does an awesome job with that as well too.
That actually brings us to that ultimate goal I think we want to get to. It would be, what are we going to reach when we can really start reaching some more comfort level? And we'll hear a lot of stuff talked about called herd immunity. And it's basically stated out there that we reach an immunity level at about 70% of our population really puts us in a really good position. Of course, certainly we would love to see it at 100% of our population have immunity, but we've really made some steps. This is going to take us a while. It's going to be a little while to get there, so that's why we always keep saying, please be patient. And I think we're going to get there once we start seeing a few more of these new vaccines come on the market, as well as we start to see more things like pharmacy partners be opened up across the state, so that we've got more access and more availability to the vaccines.
There we go. Thank you, Jason. Thank you, Chris. Thank you, Jim. We're going to open it now for questions. I know that we've got a lot of questions out there. Please look for that tab on the right-hand side of your screen. If we don't get to all of your questions tonight, please feel free to reach out to us directly. You can find us on Facebook. You can find us on Twitter. You can find us on Instagram as well. First question I have, and feel free to jump in, whoever would like to take this. There's a question about stage 2, and if it's going to be divided into 2 parts, to A, to B, etc. What do we know about that?
I'll go ahead and take a swing at that one. Sorry. It's our understanding right now that Dr. Weaver's advisory committee, Dr. Box as a health commissioner, and Governor Holcomb have made every indication that we will continue to step down by age group. The next group we expect to see will be 65 and up, then it'll go to 60 and up. I think it kind of gets a little muddied beyond that right now. I think that covers a pretty large chunk of our population that I think Dr. Weaver and her gang are still probably evaluating that and trying to find the best next steps. But as far as we know right now, 65 and over is the next step down for the state of Indiana.
All right, here's one I think, Jim, might be best for you. How soon can you schedule a vaccine if you are immunosuppressed? Do we know that yet?
Sure, and that's a great question. What I would do first is talk to your healthcare provider to make sure it's okay with your healthcare provider for you to get that to get that vaccine. Unfortunately, right now, because of our guidance from Dr. Box and the governor, hopefully we'll be able to open up that population to those individuals who are high risk for other medical conditions like this situation, hopefully soon. But right now we follow the guidance from Dr. Box and the governor as well too. But I would definitely talk to your healthcare provider even before you're able to schedule, just to make sure it's okay with your healthcare provider, because there's some data out there that says sometimes people who are immunocompromised, the vaccine may or may not work for those individuals. So we just need to make sure you talk to your healthcare provider to make sure you can get it.
Jim, I'm going to keep you here. Another question,
Sure.
Do we know if the vaccines are safe for people with asthma?
Right, and that's an awesome question. And it's actually recommended for people who do have respiratory issues, because COVID is a respiratory disease. And those are the individuals that we really want to protect, because we know if somebody does develop COVID, that it really affects the lungs pretty significantly. It can cause some significant damage to the lungs as well too. So if an individual has asthma, again, they can talk to their healthcare providers, but that's the group of population that is really recommended to receive that COVID vaccine as well too.
All right, I hate to keep you here, but again, this one goes to you.
Sure.
Regarding vaccines, when they start doing the teachers and educators, will that include all the school staff, contracted people, support staff, custodians?
Yep, so that's a great question. And I, as Tammy said, I work with all the schools except the HSE schools, because they follow in the Fisher's Health Department guidance. So one of the conversations I have with all the superintendents is they need to start thinking of when it comes time for their teachers and support staff to actually have the COVID vaccine, that they need to come up with an idea, because you cannot send all of your bus drivers at once to get the COVID vaccine, because we know some of them may have the low grade fever. They may have some of that joint pain. They may not feel well. So one of the things that I tell the superintendents is they need to start thinking how they're going to who they're going to recommend in their building to get COVID vaccine first. Like a great example, I was talking to a superintendent and I said, if 20 bus drivers are going to get their COVID vaccine, you need to make sure you have 20 bus driver subs to fill in just in case, because we don't want to have to close that school down because we don't have any support staff or teachers to teach, because all of them have that low grade fever. They just don't feel good, which about 16% of the population usually will have some signs and symptoms after their second vaccine, but not everybody. Like I had no issues with my second vaccine as well too. So with the schools, we just want them to be prepared that we don't want them to send their whole school. Then 99% of the teachers call in sick. Then what are they going to do? But yeah, their support staff, their custodians, their bus drivers, anybody who works within that school system.
Thanks, Jim. I think I'm going to throw this next one over to Jason. Jason, question, the vaccinated people who have suffered severe reactions, allergic reactions, do those people have a history of anaphylaxis due to the medications, a vaccine or anything? What do we know about those folks?
Yes, just the few reactions that have been out there that I'm aware, we have had none. Those have been reactions of people that have had known anaphylactic shock reactions and know about it in their history. We as well, besides the questionnaires and the screening that we do before they get vaccinated or ask these kind of questions, we've encountered some that say, I have an allergy to this, or I've had a reaction to that. And so that may take more monitoring. So normally monitoring after the vaccination is usually 15 minutes, but a person that's indicated some kind of reaction in the past, we monitor them for 30 minutes. If there were to be a reaction, it's going to be usually within a couple of minutes. At least that's what's been reported or what we have been told. And this is another great opportunity as well. If you schedule your appointment, if you've had some kind of reaction to a vaccine or to a bee sting, something like that, a food allergy, consult with your physician. Talk to them just a little bit more before coming to your appointment, and you can kind of discuss the mRNA vaccines and how they work and those kinds of things, and go from there. But so far, it's been going great for us. Reactions, you might say, have been the normal, which is expected from the vaccine themselves, like a flu shot. It's arm pain kinds of things. Maybe the next day, people might experience what you'd call like the low-grade fever, and that's just really the body warming up and starting to react to the vaccine in their body. It's kicking off their immune system to say, hey, it's time to start creating these antibodies so that it knows how to create the fight. So, so right now, not really seeing any problems.
Well, that's good news.
Yes.
Chris, I'm going to throw this one to you. The question is, are all Hamilton County sites using the Moderna vaccine?
And the simple answer to that is no. The 3 hospitals that we have that are providing the vaccine in the county are all capable of storing, maintaining, and dispensing the Pfizer vaccine, and they all are providing Pfizer as well as Moderna at this time. It's my understanding that everybody else is providing Moderna only. I'm not 100% sure on Walmart and Meyer, but I'm almost positive they're doing Moderna as well.
And to that, we had another person ask if you could repeat the Meyer locations. I think you broke up when you were talking about those.
Sure. The one is on West Carmel Drive in Carmel, and the other, I believe it's Mercantile Boulevard, the one in Noblesville off of 37, just east of the fairgrounds.
And another question, and maybe I would assume that you have the answer to this, but maybe you don't know. Will Walmart and Meyer be using the same vaccination record cards?
I think I'm seeing Jim nod his head in the vertical motion. We don't know for certain. We don't know how they're getting that. I presume they're getting it from State Department of Health, but that's something that I don't know off the top of my head.
All right, let me throw it back over to Jason. I know that you have this answer because we just talked about this the other day. Are you able to cancel your appointment online and then schedule again?
That has been one of the kind of the tricky things about cancellation, and as Jim mentioned about shopping or people having multiple appointments. And there's supposed to be a system adjustment coming next week. The difficult thing with making more than one appointment and canceling it is the potential, if you cancel an appointment, you may cancel all appointments. And that's one of the things that we've been finding in our clinic sites is if someone presents at our site and we can see once we get them checked in that they've got future appointments somewhere else, we can take care of canceling that. But until that time, they've actually got multiple appointments tied up in the system. So that's why it's very important that if you get an appointment, try to stick with that appointment. I know everybody would love to get in sooner than maybe the potential appointment they initially got. Just again, be patient and try to stick with one appointment.
Hey, Jim, I know that you're working the vaccination clinic every day.
Sure.
Got a question here. My 79-year-old mother is staying with us. She is from Kentucky. Can I get her a vaccine in Indiana?
So that's a great question. So currently right now, the answer is yes. But this is what I would say, though, is if she gets her first vaccine here, mom needs to hang out with you so she can get her second vaccine here as well, too. Because if she would go back home to Kentucky, they may not have that second vaccine. But again, if she comes through our clinic, she's guaranteed to have that second vaccine as well, too.
All right, now this is a common question because a lot of people don't realize yet that Fishers peeled off from the Hamilton County Health Department back in April. It has its own city health department. So someone had asked, I filled out the wait list for the Fishers Health Department. Does that mean I'm not on your wait list? Jim, you want to take that?
Sure, correct. As I mentioned earlier, we do not have a wait list because we do such a great job with vaccine management. So what I would do is I would contact the Fishers Health Department and talk to them, just because, as Tammy said, we're two separate entities and we have no control over what Fishers does with their COVID vaccines or their clinics. So I would definitely call Fishers Health Department and talk to them about that, or ask them about that question.
All right, here's one, not sure who wants it. My employer is deemed as essential by the federal government, but I don't fit the online categories. Is it only healthcare workers, first responders, and those 70 years and older?
I'll go ahead and take this one. We've dealt with this with a number of different industries that are considered critical infrastructure key resources. And right now, you know, we're sympathetic to the importance of these businesses, but right now our guidance is driven solely by Indiana Department of Health. So we follow their guidelines. And right now they are not breaking it out beyond healthcare providers, first responders, and then into the age groups.
Jason, I know you spent almost all your days out at the vaccine clinic as well. Someone's asking, do you have medical care on site to help if someone would have a severe reaction?
Yes, we do. We have those basics, and we have a doctor. Actually, as a matter of fact, it's our health officer for the county as an MD is part of our observing team. We've also established ourselves so that our in nurse as an RN, and then as well myself, I am an EMT. So we actually have 2 people in there, and we've also pre-identified with our 911 center radio communication so that if we need additional medical response to occur, we can get it direct.
All right, we're wrapping up pretty much on the questions that I'm seeing here. Again, if you've got questions, please feel free to send them to us over in this Q&A box. Is there anything that's coming up that comes up at the clinic often that you guys want to remind folks of? I know we were talking the other night and there was something just as simple as make sure that you're wearing a shirt that we can gain access to your arm. That you're having some problems with people wearing layers.
I agree, Tammy. I agree with you 100%. Be prepared to come to the clinic to get your vaccine, either in your right or left arm, and it's your choice. But be prepared to get that shot.
And Tammy,
yeah, go ahead, Jason.
I was going to say one thing I like to add, and you know, we've been focusing so much on the vaccine, and we're thankful that we're making this step over the hill. But this also is a time that we need to not drop our guard. And we're going to continue to still do those precautions that we have, and probably for some time for a while. We're still going to want to social distance. We're going to still want to wear our mask, wash our hands, do those good things that we've been doing. That way we can move down to the yellow and the blue categories, and we can get to that herd immunity, and we can do those things like see our grandkids, see our family, go to those sporting events, and still continue to do those things that we want to do. So for a while, you're still going to hear that messaging go on until we can get enough of this vaccine out there in our population to add to our toolbox of those things that we're already doing.
Well, and if I could, Tammy, I'd just like to add on to that real quick that, you know, what Jason said is 100% right. And, you know, the evidence is in looking at these numbers after the holidays when we've tightened those circles back up, but also to look at our flu numbers right now. We're at historically low levels of influenza, not just in the state, but around the world. And part of that is we're doing all these good social distancing things. We're staying home when we're sick. And, you know, all the things that Jason just mentioned, I think that should help reinforce this with the community. Exactly what he said. Keep it up, keep it going. And, you know, it's just going to speed it up that much faster.
So, Chris, let me follow up that with this question for you. We're hoping to get to the point where we can have mass vaccinations. We are limited simply by supply. There's certainly the demand. When you have enough vaccine, are you ready to scale up and scale up quick?
We are. We're moving, as we mentioned earlier, we're moving from a quite small facility on the 4-H fairgrounds to a place I don't even know how many times bigger it is, but it is going to be, the registration area alone is about 6 times bigger than what it is over in the other facility. We're going from having 5 lanes to having virtually 30 lanes available. Now, not all of them will be staffed every day, but in the event we get a large number of vaccine, we will be able to open up more lanes as more vaccine becomes available.
Here's another question for you. We saw the governor's news conference today. Chuck wants to know if you can guesstimate how soon 65-year-olds are to be vaccinated.
If I'm going to take a wild guess, I'm going to guess probably by President's Day. That's, a little over 2 weeks from now. Hopefully we're pleasantly surprised, but I'm thinking 2 to 3 weeks is probably a more reasonable time for us to get some more doses into the pipeline and get them pushed out to the communities.
I don't know who wants this, but there is a question asking if there is anything that would disqualify you from receiving the vaccination. I know we talked about the nursing moms, the pregnant women, and anybody under the age of 18, but are there any other disqualifications that would keep you from getting that vaccine? I
can take this one.
Okay.
One of the things that would disqualify you would be if you have any type of allergy to anything that's in the vaccine. That would be the only issue. Like a great example, if let's say you have severe allergies and your allergist said that you should get the Pfizer vaccine and not the Moderna, that would disqualify you from our vaccine. So then you'd have to reschedule to one of the vaccine sites at the hospitals.
Jim, while I've got you, someone said they
Sure.
missed how long it would take as long as you think it would take for the vaccine to provide some level of immunity.
Sure. So usually what we say, after your first one, you need to give the vaccine in about 14 days, and you have about 50% protection. Then when you get your second one, you need to give the second one an additional 14 days. And if we're doing the Moderna, it's a 94% effectiveness or protection. And if you're doing the Pfizer, it's 95%. So you have to wait for about 14 days after you get your vaccine, so your body will be able to make those spikes to fight off the COVID virus.
We're getting a lot of questions, people saying this has been incredibly helpful, so we're glad to hear that. Thank you. Wondering if it'll be available later. Yes, we will provide a link to all of our social media accounts at a later date. I can also send that out on Nextdoor for those of you who are not connected to social media. Question from Dan. Do we need to provide our Medicare insurance cards at the vaccination site when we arrive for our appointed vaccination?
It's
I
not
think I could probably.
Sorry, Jason. It's not required. If you have it, we do ask for it. It helps us, with the whole process. But if for some reason you don't have it, or if you're uninsured or underinsured, that should not be a barrier to you coming and getting vaccinated. This is free of charge to all Hoosiers to come in and get vaccinated here at our site.
I think it's probably worth noting too, the governor reminded everybody today that should you get your shot at Meyer, Walmart, Kroger, it should also be free. You will not be paying anything at those locations either. What kind of screening questions do they ask prior to being vaccinated? This person says when they signed up online, it only required a name, a birth date, and contact info. So what are the other additional screening questions they might experience when they get to you?
I can take this question. So we're going to ask you, are you pregnant today? Do you have a latex allergy? Have you ever had any type of allergic reaction as well too? Are you allergic to any type of medicine as well too? How are you feeling today? Do you have a temperature? Just the basic the quick assessment questions. And what will happen is when you register as well, so when you register online, you should receive another email with some more information. Like that's what happened to me when I registered. So I was sent another text message to ask me those questions. Then what will happen is when you come into our site, we'll pull up your answers and compare it. We'll double check with the questions that you have filled out with the questions that we have as well too. Then when you get vaccinated, before you get vaccinated, we're going to ask you those same questions as well too, just to make sure you're feeling okay, don't have a fever, you never had issues with any injectable medicine or any vaccines as well too. So we double check, triple check, then we check again before we actually stick the person. One thing that I would just recommend people to understand is after you get the vaccine, be prepared to hang out with us for about either 15 minutes if you don't have a history of anything, but if you do have a history or something, you may be hanging out with us for about 30 minutes, so just be prepared.
Good to know. Jason, I'm going to throw this one to you. Pam lives in Noblesville and her parents are visiting due to the pandemic for a long period. Both of them are over 70 years old, but they are not U.S. citizens. Can they come and get a vaccination?
Yes, they can. And actually, I'll give you the greatest example we had just the other day. Were two individuals and they actually had Venezuela passports. Son lived here, mother was in visiting, and we actually were able to get them their vaccine. So yes, there's no limitations to this.
All right. What about the registration process? When will it be more functional? It's very difficult to navigate. Which one of you guys wants to take that hot potato?
I'm not sure anybody does.
In their hand. Just so you all know, the registration process is run by the state health department, so it's very much out of our hands. We just happen to be there to receive you when you come in for your appointments. So I know the state is working incredibly hard on that process. I know that some people are making appointments and they're not getting in until way out in March. But the state health department is making a lot of efforts to really look at those people who are scheduled way out, and as they open new appointments, calling those folks and seeing if they can move them up the line a little bit. And I would just go back and remind you too that they do open new sites each week when they find out if they're getting more vaccine. They do open new sites around the state. You don't have to go. I mean, it's probably more convenient to go to a location in your county, but you're not limited to going to a location in your county. And they do post new appointments really early in the morning, late in the evenings, and they often do it a lot on the weekends. So those are good times to check for new appointment times if you're having a hard time getting one. Here's a question. It doesn't have to do with vaccines, but it does have to do with the COVID tests. Someone wondering if home COVID tests may be available anytime soon. What do you guys know about that?
So I can tell you on a school perspective with home COVID tests. So if a parent does a home COVID test for their child, the schools will not accept that home COVID test. It has to be done at a testing site, either at one of our testing sites within the county or at a doctor's office or an emergency department, because that data actually needs to be reported to the Indiana State Department of Health. So I can tell you if a school calls me and says, hey, Jim, parent did a home COVID test, can we accept the result? And the answer is going to be, unfortunately, no, because it has to be done by a healthcare provider. So we can dump that information into the State Department of Health, so we can look at those numbers as well too and do that contact tracing.
I have someone here too, Jim, asking if iodine allergy is.
Nope, you're good. They're perfectly fine.
Okay. All right. I don't know. Oh, here's one. Can you still get it if you're uninsured?
Yes. Right.
We're bringing the insurance cards just as a backup, right? I mean, if you're not insured or it's still free.
Here's the deal with the insurance. If you provide the insurance information, the state is allowed to bill your insurance an administration fee. That does not impact you as the consumer in any way, shape, or form. If you do not have insurance, you are still eligible to receive your vaccine. And what that does is that helps us offset the tens of thousands of dollars we're spending a day, a week, or whatever to open these clinics and still continue to operate our normal services as well. So, but again, don't let us asking for insurance be a barrier to you coming and getting your vaccine. Please, no matter what, come get your vaccine. This is a service that all health departments, and you can see all the hospitals are trying to provide and everyone else is trying to provide to you all free of charge. If we can recoup the money through the insurance, great. If not, that doesn't matter to us.
Fantastic. Any parting shots from you guys? We're running low on questions. I think we've actually done a pretty good job of answering most of them. Anything else you guys want to leave us with before we call it a night?
I just want to thank everybody for being patient and for getting those high risk populations. And it's so nice. Like, I had a lady hug me, and well, she asked me if she could hug me because I gave her a vaccine that could possibly save her life. And we had a gentleman who was, what, Jason, 102, that came to our clinic as well too, which was kind of cool to see him there as well too.
Jason, anything you'd like to add?
Yes, and again, I've said it several times. Please be patient. It's coming, and especially if you're even in a lower age group, those kinds of things. Vaccines becoming more available just over these next weeks and months. So just be patient and continue to do those good and right things that we're already doing right now.
How about you, Chris?
I would just throw out there that, vaccine is here. That's wonderful. We still need to be cognizant of the fact that the virus is being transmitted. If you're displaying any signs and symptoms, there are no barriers to getting tested as well. And, the state has put on in a tremendous capacity to test Hoosiers, and they've really gotten the turnaround times down to get your results in a timely manner so that we can help protect the population through testing as well.
All right, I think we're ready to sign off. We want to thank all of you who joined us tonight for joining us. We thank you for all your good questions. We encourage you to continue to ask questions. You can visit with us on Facebook, Twitter, social media, also on Instagram, or send us emails. Call the health department. We're happy to answer questions. We know this is confusing. We know this is a challenge, and we know that requires a lot of patience, and it's hard to have that right now. But we thank you for spending your evening with us. We will share this recording on our social media channels as well as our website, and we'll put it out there on Nextdoor as well. So have a good night and be healthy and well.